surface on this side.
So they'll inject right on top of the bone as close as
Just
they
go
can.
straight into it, yep. And then it floats.
Will they
So
inject the whole tube or?
you'll see how much is in there, yeah. It looks like a lot when you start, but it's not that much. So basically what's happening is because the cushion is torn, it's getting smaller, so now you have bone on bone that wears away the cartilage. It's like gearbox oil. If you leave it in too long, then you get all these little particles and things.
Right.
And actually the fluid gets thinner and thinner as it breaks down, and it becomes less useful. So you grind more. So you have to walk more to make more fluid, and the more you walk, the more you
Worse
grind.
it gets.
Yeah. So you're sort of screwed.
Mm-hmm.
You're going to do a little bit of local anesthetic.
Do you do an x-ray of this so you know where you're injecting before you do that?
Some of the joints you will, but the knee is a bit different because there's just one place where you can inject it. So you just pick your point of entry, whether it's feel most comfortable or where you can get in, and then you inject.
I mean, most of us have done a lot of joint injections through the years. This is something that we've always done as an office procedure. So you typically have an x-ray that you can go back on. But for the most part, when you're doing the actual procedure, we have an x-ray available at the time.
So each time you come in for a treatment, you do a blood draw?
Yeah.
So going on.
Are you also using ultrasound? I thought I read that somewhere.
Yes. So for difficult joints, where it's critical that you inject in the right space, yes. Especially you need somewhere hollow to go into. So say for tennis elbow or golfer's elbow, those things. No, it's not subacromial bursitis. It's not necessary. But once you get into the smaller things, into the joint, then yes. You can do the trochanters, which a lot of people have with the IT band syndrome and the gluteal pain. But that's sometimes a bit difficult to hit. You have to almost hit the bone and then come back a little bit and then check the resistance and then inject it. So sometimes it's easy to do blindly, and other times it's
How
not.
long does it last?
2, 3, and then you wait and see. So the most I've done in one specific joint on patients was 2, and by the time they come back for the third one, they want it somewhere else.
I've done 3 in one joint with monthly intervals.
That's a pretty bad joint.
Yeah, it was a badly arthritic joint.
Yeah.
People have good results. Certainly as good or perhaps better than the alternatives. I mean, the alternative is steroid injections or hyaluronic acid injections, right? I mean, studies have shown that this is at least as good as hyaluronic acid and perhaps better in the long term with regenerational.
Okay. Does
Their
it actually
properties.
rebuild the cartilage and
Yes.
the
Yeah.
ligament? It does.
Yes. So
Really?
the platelets contain at least 8 different growth factors. So there's nothing, because when you remove the blood from it, blood is strange because I mean you'd think it's in there, I'm injecting back, and why would it make a difference? But most of the blood cells, the red blood cells, they're already decaying, dead or dying. They inflame, they carry the disease. The same with the white blood cells. Some white blood cells are pro-inflammatory and some are anti-inflammatory. So with this process, you remove all the all the pro-inflammatory white blood cells, but you leave some of the pro or anti-inflammatory cells stay behind. So it works as an anti-inflammatory effect, same as a steroid, and then it stimulates new growth.
Will you also take an anti-inflammatory after you've had your injection?
You could, but I mean, I haven't felt anything so far, and I've never had a patient that afterwards said, oh, it hurt the next day or the next day. It doesn't.
The only time you might feel some discomfort is if you inject a small joint,
Right.
you know, like a toe joint or finger, like a
Knuckle.
thumb joint, just because you're injecting a bit of volume into the joint.
Very
Right.
small.
But a large joint like a knee is generally quite painless.
Really?
Wow, really?
It suggests that there's stimulation of the cartilage cells, the chondrocytes, so it certainly can delay the deterioration. Whether it actually rebuilds is hard to say, but it certainly helps to delay the decay, right?
Now, trying to get in for a knee or an operation or a shoulder,
Yeah,
it
it's
just
right.
takes forever.
I would
My
say this has a
brother-in-law's
really
going
good place
2 years.
for people awaiting surgery who know they're a year or 2 years away, where
Yeah.
alternatives have always just been steroids,
Right.
right?
Yeah.
Or hyaluronic acid.
Yeah, I'm in that. I'm 51, so I'm in that in-between age where nobody's going to do a meniscectomy on me or a arthroscopy because it's going to speed up my chances of getting a knee replacement. But if you do it now, then I'm going to have 5 good years maybe from it. But then at 60, I'll be begging for when do I get the knee replacement. So if it's inflamed, you do cortisone, then you have a good effect. But say you have an osteoarthritic process with limited inflammation, you do cortisone, it virtually does nothing. If you have a lot of grinding taking place, you do cortisone, doesn't do anything. But then the hyaluronic acid may make a big difference. So you have to have the proper indication for it. With this, it doesn't ask that question. You inject it, it's anti-inflammatory and it's pro-lubricating.
Mm-hmm.
What's the difference between this and the injection?
It's going to suck 100 times that volume of water into the knee, and that helps to lubricate the knee. And if you feel it, it's incredibly slippery. But basically, it just takes the grinding away. But if you have a lot of inflammation with limited grinding, then it doesn't really do anything. That's why you get about a 50% response with it. It's magic, did nothing, waste my money.
So what I've done so far is Andre had some local anesthetic cream on his skin beforehand, so it numbed the surface. Then I took typical local anesthetic and injected it into the deeper tissues and slowly advanced it into the knee joint, so it's already positioned. And then as soon as Morello had the preparation ready, we're just connecting and injecting, so it saves on a second needle. So essentially that needle now is already positioned where it needs to be. The area through the skin is numb, and now basically very slowly I'm going to inject the plasma, the platelet rich plasma.
It's incredibly painful.
Do you feel
It
pressure?
feels like a poker, it's unreal.
Do you feel pressure?
Oh,
I'm so good he doesn't feel it.
He's gonna phone in sick tomorrow.
Yeah.
I'm going to lose the leg,
Setting
yeah.
himself up.
So I mean, ways to minimize discomfort would be
Nothing.
obviously to freeze it first.
Because the
and to
volume
inject
is
it
not
slowly.
that high, and it,
But
the-
yeah, if
the
we did a
water
small
disperses
joint, I would
around it,
only
so.
do like one
When you
and
get
a
the-
half
the
cc. That can take 4 cc's, no problem, right? And Andre, I think, can attest it wasn't too painful. I didn't feel a thing. So.
Hard on your back.
Yeah, that was the worst.
Yeah.
So are they not doing meniscus repairs like arthroscopies anymore?
If I've had one patient in the last 3 years that had an MSP covered arthroscopy, that would be just one patient. Where 20 years ago they would do them every
Yeah.
week, they would just, yeah.
Yeah.
Actually, probably the majority of my arthroscopies done in the last 5 to 6 years all private because MSP.
Hmm. But that used to be the step, right?
Yes,
Before the,
yes. Imagine.
and they're not doing that
No.
anymore.
It basically stopped after a trial that was done in Alberta. Some of you may have heard the story. What they did is they did sham surgery. So 50% of patients had anesthetic with arthroscopy and meniscectomy. Other 50% had the anesthetic. They did the surgery, but they only made the holes and they stitched them up, and that's it. And they told them they had the surgery, and then they followed them. And the group that had the sham surgery did better than the group that had the real surgery. Of course, I mean, they were in so much trouble afterwards, it was not even funny. But that changed the way the whole world did
Yeah.
arthroscopies on knees, because
Yeah,
why would you do it if it doesn't do anything?
yeah.
So what was your
better already?
what was your experience
The only pain
from
from
start to finish?
nada. It's just this bed is uncomfortable. Nothing. I haven't felt a single thing.
Okay.
And I have a very low pain threshold.
So the
Can you
top
bend the knee easily? Do you have to wait for, oh, really?
Nothing.
So at the very minimum, it's going to be better lubricated
Right.
now, right?
Mhm.
And then the process should be repeated, ideally 4 to 6 weeks from now,
Right.
and again.
4 to 6 weeks?
I would do 2 to 3 times.
Oh, I see.
Like a series, right?
Right.
I mean, that's when you get best results.
Right.
But generally speaking, most people, I mean, it depends on the advanced stage of your condition, right? I mean, if you have a severely arthritic knee, I mean, unfortunately, you're going to get some relief, but I don't think you'll get the relief that somebody in an early phase might get.
Right.
And I mean, soft tissue injuries, tendonitis, things like that, that's a different story altogether. You know?
Okay.
So I think with Andre's case, I mean, it's relatively mild and early, so I think he'll get good results.
What about hips? Do you do the same technique on hips?
Well, hips, I mean, a hip joint injection is a more difficult injection.
You have to use the ultrasound.
Yeah,
You do
so
the-
for that you would need
if
guidance.
if you do this, that most people think this is my hip joint is killing me. This is just the trochanter. There's a bursa there. so you don't need that.
Those are
very
simple to do,
Yeah.
but a hip joint injection, you need a long needle and you need ultrasound guidance, right? Most other joints, shoulders, toes, fingers, those are easy to do without ultrasound, but a hip is a trickier one.
So you asked the question about the soft